You look in the mirror and wish your smile was brighter. Maybe you've got an important event coming up, or you've noticed your teeth aren't as white as they used to be. So you grab a whitening product and start using it. But here's the thing. What you're doing right now to whiten your teeth might actually be permanently destroying your enamel. And I'm not talking about temporary sensitivity. I'm talking about damage that can never be reversed. Today, we're covering the biggest teeth whitening mistakes that people make every single day. Mistakes that dentists see constantly, but nobody really talks about. By the end of this, you'll know exactly what to avoid if you want a whiter smile without wrecking your teeth. Let's start with the most common mistake. Using whitening products too frequently. You buy whitening strips or whitening toothpaste and figure if a little is good, more must be better. This couldn't be more wrong. Your tooth enamel is the hardest substance in your body, but it's not indestructible. When you use whitening products, they contain peroxide or other bleaching agents that penetrate your enamel to break up stains. But here's what most people don't realize. Every time you whiten, you're temporarily making your enamel more porous and vulnerable. If you give your teeth proper time to recover between treatments, your enamel can remineralize and strengthen again. But if you're whitening every single day or using strips back to back without breaks, you're not giving your enamel any recovery time. You're keeping your teeth in a constant state of vulnerability. Over time, this leads to enamel erosion. Your teeth become thinner, more translucent, and ironically, they can actually start to look more yellow, not whiter. Why? Because the yellow dentin layer underneath starts showing through the thinned enamel. I've seen people use whitening strips for months straight thinking they're improving their smile, only to end up with teeth so sensitive they can't drink cold water without pain. The instructions on these products exist for a very important reason. If it says use once a day for 2 weeks, then take a break. That's not a suggestion. That's protecting your enamel from permanent damage. Mistake number 2, using the wrong concentration or leaving products on too long. Most over-the-counter whitening products have peroxide concentrations between 3 and 10%. Professional treatments can use up to 40%. Because over-the-counter products are lower concentration, people assume they're completely safe to use however they want. So they leave whitening strips on longer than recommended, thinking it'll give better results. The package says 30 minutes, but they figure an hour would be even better. Or they use whitening gel overnight. This is a disaster. When you exceed the recommended time, you're overexposing your enamel to the bleaching agent. This doesn't just increase sensitivity temporarily. It can cause chemical burns on your gums and accelerates enamel breakdown. Plus, there's a point of diminishing returns. After a certain amount of time, the whitening agent stops working effectively anyway, so you're causing damage for literally no benefit. Your teeth aren't getting whiter, they're just getting weaker. Mistake number 3, not preparing your teeth properly before whitening. Most people think they can just apply whitening strips and go. But if you have untreated cavities, gum disease, or exposed roots, whitening can go from uncomfortable to excruciating. Here's why. Bleaching agents are designed to penetrate enamel. But if you have a cavity, there's no protective layer. The whitening gel goes straight into the inner parts of your tooth, hitting the nerve directly. This causes intense pain and can make cavities worse. Same thing with gum disease. If your gums are inflamed or receding, they won't protect the sensitive parts of your teeth from the whitening agent. You end up with chemical irritation on already compromised gum tissue. This leads to more recession, more sensitivity, and serious problems. And here's the kicker. Even if you tough out the pain, your whitening results will be terrible. Teeth with cavities or decay whiten unevenly. You'll end up with splotchy, uneven coloring that looks worse than when you started. This is why dentists recommend getting a checkup before starting any whitening treatment. They need to make sure your teeth and gums are healthy enough to handle it. It's not about upselling services. It's about preventing serious damage. Mistake number 4, combining multiple whitening products at once. Maybe you're using whitening toothpaste in the morning, whitening mouthwash after lunch, and whitening strips at night. Or doing professional treatments, then using over-the-counter products to maintain results. You're essentially bombarding your teeth with bleaching agents all day long. Your enamel never gets a break. Each product might be safe on its own, but when you stack them together, you're dramatically increasing exposure to whitening chemicals. It's like taking multiple pain relievers from different brands and not realizing they all contain the same active ingredient. You think you're being safe following directions on each package, but you're actually overdosing your teeth. This overexposure leads to rebound sensitivity. Your teeth become so sensitive that even breathing cold air hurts. Unlike temporary sensitivity that goes away after you stop whitening, rebound sensitivity can last months or become permanent. Your teeth become constantly painful. Plus, you're accelerating enamel wear and increasing risk of cracks and chips. If you want to maintain white teeth, focus on preventing new stains. Cut back on coffee, tea, red wine, and tobacco. Use a straw for dark beverages. Rinse your mouth with water after eating anything that stains. These habits do way more for maintaining whiteness than over-whitening ever will. Mistake number 5. Using abrasive whitening products. Not all whitening toothpastes work the same way. Some contain bleaching agents like peroxide, but many, especially cheaper ones, rely on abrasives to physically scrub away surface stains. Ingredients like baking soda, silica, or calcium carbonate. In small amounts, these can be fine, but many whitening toothpastes have abrasives that are way too harsh. Think of it like this. Using abrasive whitening toothpaste is like sanding down your teeth every single day. At first, you might remove some surface stains and teeth look brighter, but over time, you're wearing away microscopic layers of enamel, and enamel doesn't grow back. Once it's gone forever. As your enamel gets thinner, teeth become more sensitive, more prone to cavities, and more prone to staining. It's a vicious cycle. And while we're talking about abrasives, let's discuss DIY whitening remedies. Baking soda, activated charcoal, lemon juice. These are all over social media as natural whitening solutions, but most are either ineffective or harmful. Baking soda is extremely abrasive. Activated charcoal has no proven whitening benefits and is also very abrasive. And lemon juice? That's acid. You're literally bathing your teeth in acid, which dissolves enamel. It doesn't whiten your teeth, it erodes them. If something sounds too good to be true, like a natural remedy that works as well as professional whitening, it probably is. Mistake number 6. Ignoring sensitivity warnings. When your teeth start hurting during whitening, that's not just an annoying side effect to push through. It's your body telling you something is wrong. A little sensitivity is normal. Your teeth might feel tingly or slightly uncomfortable for a day or two, but if you're experiencing sharp, shooting pain, if you can't drink anything cold, if sensitivity lasts more than a few days after stopping whitening, that's a red flag. What's happening is the whitening agent has penetrated too deeply, or your enamel has become too thin and compromised. The nerves inside your teeth are being exposed to stimuli they shouldn't be exposed to. If you keep whitening despite the pain, you're making it worse. You're potentially causing permanent nerve damage. I know it's tempting to power through, especially if you've invested money or have an important event coming up, but the long-term consequences aren't worth it. If you experience severe sensitivity, stop whitening immediately. Give your teeth at least a few weeks to recover. Use toothpaste designed for sensitive teeth, and if sensitivity doesn't go away, see a dentist. You might need fluoride treatments or other interventions to help your enamel remineralize. Mistake number 7. Not following proper aftercare. Whitening isn't one and done. If you want to maintain results and protect your enamel, you need proper aftercare. Right after whitening, your teeth are more porous than usual. This means they're more susceptible to staining. The first 48 hours after whitening are crucial. During this time, avoid anything that could stain your teeth. Coffee, tea, red wine, dark sodas, berries, tomato sauce, soy sauce. If it can stain a white shirt, it can stain your teeth right now. Many people whiten their teeth, then immediately go out for coffee or red wine to celebrate. Then they're shocked when teeth pick up stains quickly. You just made your teeth more vulnerable, then exposed them to exactly what causes stains. You should also avoid acidic foods and drinks for a few days after whitening. Acid softens enamel, and since your enamel is already weakened from whitening, acidic foods cause even more damage. No citrus fruits, no vinegar-based dressings, no sour candies. Be extra diligent about oral hygiene after whitening. Brush gently with a soft, bristled toothbrush and fluoride toothpaste. Floss daily. Use fluoride mouthwash if your dentist recommends it. This helps enamel remineralize and strengthens it after the whitening process. Mistake number 8. Having unrealistic expectations about what whitening can do. Whitening doesn't work the same for everyone and has limitations. If your teeth are yellow or light brown from surface stains due to coffee, tea, or smoking, whitening can work really well. But if your teeth are gray or have discoloration from medication, trauma, or certain medical conditions, whitening might not help much. It can even make discoloration look worse or create uneven results. Also, whitening only works on natural teeth. If you have crowns, veneers, fillings, or bonding, those won't change color. You might whiten your natural teeth and end up with a smile where some teeth are bright white and others are the original shade. This looks really obvious. Some people expect blindingly white Hollywood-style teeth, but natural tooth color varies based on genetics. Some people's teeth are naturally more yellow-toned because they have thicker dentin layers. You can lighten them, but you won't get them unnaturally white without more invasive procedures like veneers. Constantly chasing that unrealistic ideal by over-whitening is how you destroy your enamel. And finally, mistake number 9. Skipping the dentist altogether. I know professional whitening is more expensive than over-the-counter products. It takes more time to schedule an appointment, but when you whiten under a dentist's supervision, they customize the treatment to your specific needs. They adjust the concentration based on your enamel thickness, sensitivity levels, and type of staining. They protect your gums properly so you don't get chemical burns, and they monitor your progress to make sure you're not causing damage. Plus, professional whitening is more effective. You get better, longer-lasting results in less time. Instead of using whitening strips every day for weeks, you might just need 1 or 2 sessions. Look, wanting whiter teeth is completely normal, but the way you go about it matters tremendously. Your enamel is precious and irreplaceable. Once it's damaged, you can't get it back. Use whitening products as directed. Don't overdo it. Don't combine multiple products. Listen to your body when it's telling you something is wrong. Prepare your teeth properly before whitening. Follow aftercare instructions religiously. Have realistic expectations about results. And when in doubt, talk to a dentist before starting any whitening treatment. A healthy smile is always better than a damaged white one. Take care of your enamel, and it'll take care of you for life.